Cardiac arrest kills more people every year than breast cancer, lung cancer, or AIDS.
So, what can you do to protect yourself or even save someone else's life? Well, joining us today to tell us more about sudden cardiac arrest is Dr. Keim, who's a cardiologist and director of the Electrophysiology Lab at Peninsula Regional Medical Center. Thank you for coming in today.
Thank you. Thank you.
All right, so how is sudden cardiac arrest different than a heart attack?
Well, I know every time you talk to a cardiologist, there's always this sense of time urgency and immediacy, but there is quite a difference between a heart attack and sudden cardiac arrest. A heart attack is a blocked artery of blood going to the heart. The symptoms develop over a period of time, much like it takes minutes to longer to eat this orange and peel this orange. Symptoms of a heart attack last for minutes. Permanent damage doesn't start for 30 minutes or 60 minutes. Still important to get to the hospital quickly for treatment and all that because there are time constraints. Like this apple that's ready to eat now, sudden cardiac arrest is an immediate, catastrophic, sudden onset, unexpected collapse of the patient and stoppage of all blood to every part of the body. So not just blood flow to the heart, blood flow to the brain, blood flow to the kidneys, and permanent irreparable damage starts on the order of 6 minutes. So treatment has to be started immediately, has to be on site. There's no time to drive to the hospital. So awareness and anticipation is really part of the fundamental treatment of this problem.
So who's at risk?
Well, the people in our society who continue to be at the risk are people who have previously had a myocardial infarction or a heart attack. And that's where part of the confusion comes about, because it's still the people most at risk are people who have previously had a heart attack.
Let's say I'm looking at you. Is there some way I can know if you're going through a sudden cardiac arrest? Is there something to look for?
Well, so because it's associated with the complete and total lack of any circulation of any blood, everything immediately shuts down. Within 15 seconds, the EEG on the brain, for instance, is flatline. So you are clinically dead in 15 seconds when this hits you. Doesn't mean that permanent damage is going to happen, but a collapse. The patients universally collapse. They're not going to respond to you. They're usually not breathing at all, and you're unable to achieve a pulse. So it is upon you. You know it.
So what do we do? This happens. What do I do?
So the two most important things, I think, for an individual to do is have some anticipation preparedness prior to this. Part of what this whole exercise is all about. Understand how to activate response time. The only definitive treatment for this is, as you heard, is a defibrillator with it. And even that doesn't work all the time, but that is the definitive treatment. The American Heart Association has really simplified basic life support now to it's really simply chest compressions. So none of us really have any responsibility for not being able to provide chest compressions. So your first response is to call for help, or if you're in an area on a repeated venture, understand that there are AEDs everywhere. If you walk through the airports anywhere, they will. So if you go to a place at work or whatever, I think it's incumbent on you to sort of know what's there. They're quite easy, they're visible, they're simply open up, they are user friendly. They come with packages that you open up the pads and you put them on. The device actually will talk to you. There will be an on button that you will activate. You'll open up the pads, you'll put them on. You can peel them off, plug it in, and literally from that, the A is exactly what it is. It is automatic, okay? You cannot hurt the patient by putting this on. So not to put it on, not to be aware, is really a missed opportunity with it. And I think if you look around, you will find these around our environment and all. As just a matter of choice, if you're part of a organization that's with it, making sure that you have these at your workplace, making sure that they're at your school, at places where these types of events are likely to occur.
Let's talk a little bit about preventative measures. Healthy lifestyle, of course, right?
Well, sure. So because the most people most likely to have this problem have had a heart attack, all the things that we talk about preventing a heart attack are certainly important. I think for the people who don't have those risk factors or haven't had a heart attack, smoking cessation is clearly one of the most important things. Controlling your blood pressure, your diabetes, and of course exercise along with it. For our younger populations, paying attention to symptoms that might occur. Passing out is never normal. Passing out should engender a physical evaluation and not. most patients, like these young kids who collapse on the field, have had previous episodes of passing out and frequently have family members who have similar histories. So if it runs in the family, there is a genetic component. These kids are generally, they have a metabolic error or a structural error that is genetically defined. With it. So it is discoverable before. It's one of the reasons we have physical exams prior to participation, for instance. That would, of course, be very important.
Dr.
Keim,
Keim,
thank you
so
for being
much.
so passionate about this, too. It shows.
And if you'd like to read more about sudden cardiac arrest, go to WBOC.com and click on our picture at the top of the page.